Western State Hospital neglect the court-ordered care of one of its patients. That's what we're trying to find out. After court documents unveil he went months without the right treatment. Now he's dead. KIRO 7's Brandon Thompson is pressing the state for answers. So Brandon, what do those documents show you?
It shows a months-long battle from this patient's attorney, Monique, to try and get trauma therapy for abuse that this man suffered as a child. Now, this is the construction site where he was found dead with these several large cranes, part of an expansion project at the Washington State Hospital. Down this road on the other side, you can see the hospital building where this patient had been living for years. The patient's attorney and medical examiner records identify the patient as Pavel Kolchak, who has been in the care of the Department of Social and Human Services since 2008, pleading not guilty by reason of insanity to a bank robbery. The legal battle to get him trauma therapy, court documents show, started in August. At least 2 Western State Hospital psychiatrists recommended the treatment. In November, Kolchak asked the court for it himself. His attorney saying in November court filings, quote, despite the years-long delay in adequate care, Mr. Kolchak's current and former therapist and an expert forensic psychologist have all recommended that Mr. Kolchak continue to engage in trauma therapy in order to gain insight into triggers and future risk management. She goes on to say, quote, it is perplexing that DSHS would take a position contrary to the clinical recommendation of the WSH treatment teams. And, quote, whatever the reason, DSHS's opposition to clinically recommended treatment is not based on professional judgment and has caused a delay in providing Mr. Kolchak with adequate and individualized care. On December 18th, a court ordered DSHS to provide the treatment, giving them a week.
Brandon with KIRO 7 News.
And we've been reaching out since Tuesday, trying to get answers from the agency.
We're actually past 26 hours for the questions that Sean sent you all yesterday. And
all they have said to us is this: the patient was last seen Sunday morning, was overdue from court-ordered unescorted grounds privileges that afternoon, and was found by construction crews dead Monday morning. So DSHS tells me that patient privacy laws prevents them from answering some of our questions, but we wanted to know specifically what lengths did they take in looking for Kolchak? What are their protocols around missing patients? Was the public notified? And what was staff told about this? They have answered none of those questions. Live in Lakewood, Brandon Thompson.